Hello and welcome. Today we're diving deep into a condition that affects balance and hearing, Ménière's disease. It's a complex disorder, and understanding it is key to managing its effects. Let's embark on this journey to unravel the mysteries of Ménière's disease. The exact cause of Ménière's disease remains elusive, making it a challenging condition to understand fully. However, current research points towards a combination of factors that likely contribute to its development. One leading theory revolves around endolymphatic hydrops, which is an abnormal buildup of fluid in the inner ear. Genetic predisposition is believed to play a significant role, meaning that individuals with a family history of Ménière's disease are at a higher risk. Viral infections have also been implicated, with some studies suggesting a link between certain viruses and the onset of Ménière's symptoms. Furthermore, autoimmune reactions, where the body's immune system mistakenly attacks healthy tissues in the inner ear, are being investigated as potential triggers. Vascular issues, such as problems with blood flow to the inner ear, and head trauma are also considered contributing factors. It's important to note that these factors may interact in complex ways, making it difficult to pinpoint a single definitive cause for each individual case. The inner ear is a marvel of biological engineering, housing the cochlea for hearing and the vestibular system for balance. In Ménière's disease, the endolymphatic sac, responsible for regulating fluid volume and pressure within the inner ear, malfunctions. This leads to endolymphatic hydrops, or an abnormal accumulation of endolymph fluid. This excess fluid distorts the membranes within the inner ear, disrupting the normal functioning of hair cells responsible for transmitting sound and balance signals to the brain. The result is a cascade of debilitating symptoms. The swelling and pressure fluctuations can cause temporary hearing loss, fluctuating tinnitus, and the hallmark symptom vertigo, which creates a false sense of spinning or movement. The exact mechanism by which hydrops causes these symptoms is still under investigation, but the underlying principle is the disruption of the delicate balance and fluid dynamics within the inner ear. Ménière's disease is relatively rare, affecting an estimated 1 in 1,000 individuals worldwide. While it can occur at any age, it most commonly appears in adults between the ages of 20 and 60. There is no significant difference in the prevalence between men and women. However, familial clustering suggests a genetic component, meaning individuals with a family history of Ménière's disease are more likely to develop the condition themselves. It's worth noting that due to the variability in symptoms and diagnostic criteria, the true prevalence of Ménière's disease may be underestimated. The signs and symptoms of Ménière's disease can be quite distressing and unpredictable. The classic quartet includes vertigo, which is a sensation of spinning or whirling, even when you're still hearing loss, often fluctuating and primarily affecting low frequencies. Particularly in the early stages, tinnitus, a perception of ringing, buzzing, or roaring in the ear, which can be constant or intermittent, and a feeling of fullness or pressure in the affected ear, known as oral fullness. These symptoms typically occur in episodes or attacks, which can last from 20 minutes to several hours. Between episodes, some symptoms may subside, but hearing loss and tinnitus often persist to some degree. The severity and frequency of attacks vary greatly from person to person. Diagnosing Ménière's disease can be challenging, as there is no single definitive test. Diagnosis is primarily based on a combination of medical history, physical examination, and specific diagnostic tests. An audiogram, or hearing test, is performed to assess the extent and type of hearing loss. Vestibular testing, including electronstigmography, ENG, or videonystigmography, VNG, evaluates the function of the balance system. An MRI of the brain may be performed to rule out other conditions that can cause similar symptoms, such as acoustic neuroma. The diagnostic criteria established by the American Academy of Otolaryngology Head and Neck Surgery at AAO-8NS are commonly used to confirm the diagnosis. These criteria typically require the presence of episodic vertigo, fluctuating hearing loss, tinnitus, and oral fullness. While Ménière's disease doesn't have distinct subtypes, it's important to acknowledge the variability in symptom presentation and disease progression. Some individuals experience primarily vestibular symptoms, with frequent and severe vertigo attacks, while others have more prominent auditory symptoms, such as significant hearing loss and debilitating tinnitus. The severity and frequency of attacks can also vary widely, with some individuals experiencing infrequent episodes and others suffering from near-constant symptoms. This variability highlights the importance of tailoring treatment plans to the individual's specific needs and symptom profile. Unfortunately, there is no cure for Ménière's disease, but various treatment options are available to manage the symptoms and improve quality of life. Treatment strategies fall into several categories. Dietary modifications, such as reducing sodium intake and avoiding caffeine and alcohol, may help reduce fluid retention in the inner ear. Medications, including diuretics to reduce fluid volume and anti-vertigo drugs like meclizine or diazepam, can help alleviate symptoms during acute attacks. In more severe cases, steroid injections into the middle ear may be considered to reduce inflammation and improve inner ear function. For individuals with intractable vertigo, more invasive procedures, such as endolymphatic sac decompression or vestibular nerve section, may be an option. Vestibular rehabilitation therapy can help patients adapt to balance problems and improve their overall stability. Finally, hearing aids can be beneficial for managing hearing loss, and tinnitus retraining therapy can help reduce the perceived loudness and annoyance of tinnitus. While there's no guaranteed way to prevent Ménière's disease, certain lifestyle modifications may help reduce the frequency and severity of attacks in individuals who are already diagnosed. Maintaining a low sodium diet is often recommended to reduce fluid retention. Avoiding caffeine, alcohol, and tobacco can also help minimize symptoms. Managing stress through relaxation techniques, such as yoga or meditation, may be beneficial. Getting adequate sleep and avoiding overexertion can also help prevent attacks. For individuals with a family history of Ménière's disease, genetic counseling may be an option to assess their risk and discuss potential preventive measures. The prognosis for Ménière's disease is variable, with some individuals experiencing long periods of remission and others suffering from chronic, debilitating symptoms. While the vertigo attacks may decrease in frequency over time, the hearing loss is often progressive and can eventually lead to significant hearing impairment. Recent research is focused on developing more effective treatments to target the underlying causes of Ménière's disease. Gene therapy and stem cell therapy are being explored as potential future treatments to restore inner ear function and prevent disease progression. Advances in imaging techniques are also allowing for better visualization of the inner ear, which may lead to earlier and more accurate diagnosis. Continued research efforts are essential to improve the prognosis and quality of life for individuals living with Ménière's disease.